I can stop everything, do that, but then I'm not doing justice to my patients because I do justice to my profession and my patients. So I'll go the slow way. So idea is that you're passionate, go for it. I don't know where I'm going to reach. I'm also in the experiment stage. I've joined the Docpreneur Academy. I'm lucky to have joined that. So that's giving some insights. And going ahead, I will require funding. So I'm going to approach Pranav sir and Mugaji how we can get the funding from some angel investors.
Hello, Kishore, how are you?
Hi.
Welcome to another episode of Hall of Fame interviews, in which we have today a very interesting person. He's a very hardworking and industrial background. He is Dr. Kishore Madhavani. So he is a 64-year-old young doctor, and he has introduced himself into a new branch with industrial medicine. Not many people have explored. He's done his MBBS and MD in community medicine. After that, he has done specialized courses for the ergonomics in the healthcare and especially office health. Welcome, Dr. Kishore, and congratulations for the Hall of Fame.
Thank you, Dr. Pranav Sharma ji. It's really a privilege and honor to be here, and I am thankful that to you and Amit Singh Mogaji that I could join your community. So after joining, I've got a little bit more confidence, guidance, how to go ahead. I've been able to develop my practice further. So I do corporate occupational consultancy. I work as a consultant providing wellness services to corporate employees, and these wellness services comprise of one-to-one curative services, but also health, promotional, and skill development services. So in the corporates, we provide remote care and also on-site clinical care. And we've developed a medical kit, which we give to our employees, and they can use it at office. When they are traveling, they can just put that kit with them in their travel bag. And at home also, they can use it. So the employees, when they're at home, their family members also not well, they have all the medicines with them. So they just give me a call and treatment starts. And that also helps in getting a better rapport with the employee because I become closer to them. Medicines are with them. My prescription is there and they can consult me anytime, 24/7. Along with this, I also look after the other aspects because lifestyle diseases is at the forefront. So we run a program called as Wellness Matrix in these organizations. And we calculate a matrix for each employee. So when you calculate a matrix for each employee, you get the matrix of the entire organization, all the employees who participate in the program. So at a glance, you come to know how many are in good wellness and how many more need to optimize their wellness to achieve holistic wellness excellence. So we have done a color coding based on the parameters that the employees have. We designate them as red, yellow, or green. We give them these colors. If they are in very good health, they get green color. If they have issues like cholesterol or stress, then they get a yellow color. But if they are highly diabetic, very much obese, very much stressed out, then they get a red color. But along with this, I have also made another color now because sometimes what happens, we find that the green people do have issues and they also have problems. So where we find that there's a family history of heart disease, if a person is not exercising, person is smoking, some risk factors are there. So there we are giving a purple color so that, these are the people who need to be monitored. In the greens also, we give a purple green so that, we look after them because the idea is to pick up problems earlier. Today, heart attacks, cancers are increasing. So we need to stratify the employees as to what is their status. And this helps the organization because at a glance, you come to know how many are obese, how many are having cholesterol, how many are having mental health issues. So it helps us to direct our interventions in the problems which are there. And this is a real very good way of assessing the wellness of the employees of an organization. And this model, which has been developed by me and it is now patented and copyrighted. We have trademarked it also. So this has been devised by me because over the years I've been working over it for last 8 to 10 years with corporates. So, and a similar type of model like this has been presented at the World Economic Forum at Davos as one of the best models for corporate health. So this is what I give to the corporate organizations. So we give a total package, curative package, where they have access to me 24 hours and also preventive, promotive, and lifestyle modification with wellness metrics. I have also specialized and done my PhD in office ergonomics, and that I've done it in life sciences from Gujarat University. and I was a student of ICMR's National Institute of Occupational Health. Now, this I did part-time at the age of 52, and I completed at the age of 58. Today, I'm 64. Those 6 years, I went all over the world doing the PhD on office ergonomics, on work postures, and believe me, it's been a satisfying experience. And my book on this is going to be released very soon, and the book is for the masses. And my TEDx talk is also out, which I will share with Pranavji, and if possible, share it with the Dr. Pranav community. Because if you have some knowledge and you can help the lives of people, that is what the best thing. So more knowledge we acquire, we must share it with our patients, with our colleagues, so that they lead better lives. The purpose of Wellness Matrix, the company that I started is Innovative Wellness Sculptors, where for patients also, we want to give the medical kits, and we want to give the AI-driven healthcare devices that are USFDA approved, so that they can understand their parameters better. They can measure their own blood pressure, they can take the ECG on their own, and very soon, maybe we will be giving them a digital stethoscope. So the individuals, patients, they can send you the sounds, because all this is based on AI. But AI cannot replace a doctor. The reports have to be shared with us, whether it's ECG, whether it is the stethoscope, and then we can decide what the patient requires. So the future in the next 1 or 2 years is going to be totally different. The patients do not have time to come to you, of course, face to face, very important. But many a times it's a holiday, somebody's late night. Well, this is one more way of being in touch with patients. Many of them are traveling abroad. So if they are in touch with you on the mobile, well, mobile has really helped us. And in this, we can reach remote areas. The kits which I've made, I'm also sending to rural areas. And very poor people, they also can have access because the cost of the kit is very low. So this is my aim. I want to make life easier for people, whether it's a corporate employee or it's somebody in the village or my patient in the urban area. So that's what I would share with you. Thank you. Thank you so much.
Basically, let me ask you first thing, that this device that you say, that is taking the blood pressure and ECG.
ECG device takes 6-lead ECG. Apple, you get 1-lead ECG. This device, you get 6-lead ECG. 6-lead ECG, it gives you 1, 2, 3, AVR, AVL, AVF. It gives these leads, but inferior wall infarction is picked up. In case the problem in the anterior leads, the result from AI will come as unclassified. But then you always have a backup of doing a blood test and all. But believe me, the device is fantastic. Even a child can do the ECG with it. It's done on the left thigh. You can do the ECG, or the left ankle. And regarding the blood pressure, the app is made by a very reputed company, electronics company in India, which is a multinational company. And the app is to be downloaded on your smartphone, and the blood pressure will be recorded on your smartphone. And it's accurate. It is approved by the CDSCO, our Indian FDA. So both the device, the EC device is approved by US FDA and CDSCO. The BP device, which is on the smartphone and app, is also approved by the CDSCO. Devices which are given regulatory approval, those only I'm giving, so that patients have faith in them and we get accurate results. There's more than 90% accuracy in all these devices.
This BP and the ECG. How do you reach that? How does the information reach you?
See, the patients take it out on devices work on Bluetooth. So the patient can download on their WhatsApp and send me the WhatsApp recording.
Okay.
Even the sounds come on WhatsApp. The suppose you're doing a stethoscope, they will come on WhatsApp. The sounds come, and the blood pressure recording, the patient can tell me that on the smartphone this is the reading. So at least a screening is done, and these are quite accurate. And if suppose you find it's a bit high, it can always be cross-checked by a doctor. But the ECG part is good. If there's any issue or we suspect that there's a problem, then cardiac enzymes, top T, top I can be done, and we can have the reports in an hour's time.
We are in the transformational zone in healthcare, where the machines and implants will be the major role to play. How did this come to your mind? I should do something like this.
Well, yes, thank you so much. Very good question. What happened during the pandemic? My work increased threefold. I was sitting at home, and people are sick. So the corporates, where I had worked, all needed a doctor. So I had my colleagues over there in the organization. They said, will you look after our company? So my work increased threefold. So I joined around 6 companies during the pandemic. Earlier, I was at 2 or 3. Now, the thing is, online consultation was a challenge. I used to wonder how will I do it. But let me tell you, by WhatsApp, it is very easy. If I want to examine a patient who's got a backache, so I tell them to hold the camera and I tell the patient, please raise your leg one by one. So straight leg raising test is done. Now, if I want to palpate, I tell the spouse that you please press this area of the back. So they can press. If you want to see the tonsils, we explain to them that send us a photograph or a video. So now today, online consultation, we had challenge, but we are now mastering it. But then what happens about ECG, blood pressure? Well, people have to buy machines at home they bought. But what about a poor man? If I give them an app, fantastic. And ECG machines were very expensive. People had to go. But nowadays, these ECG machines are quite affordable. So this is the model I want to introduce to our patients so that they can use it in home. They can use it at travel. Once they travel in India, once they travel abroad, well, I'm there with them. So that's where the idea came from the pandemic, that it is the phone which is going to be the game changer. Let us exploit the mobile phone technology. Believe it or not, that I was invited to Fiji Islands in Australia to talk to the doctors there about these devices. So Fiji said, yeah, we want it. But the problem, the challenge is that internet connectivity on the islands is a problem. So for these devices, it's very important. They work on Bluetooth. But when you want to send the message, you need the internet. So the internet connections is very important. So if you have the internet, you have a smartphone, well, you got everything.
So you have many patients from abroad also?
Yes, sir. I have. See, this so happens nowadays, if you are in practice, we are in family practice and we look after everybody, the children, and we look after the adults, right? So the children, many of my patients, the children are abroad either studying or they're working. So when they're settled there, so many, somebody's children in Dubai, somebody in Singapore, somebody in UK, somebody in USA. Well, and there are so many students going abroad. And on last Sunday, I had a student from abroad saying that, Doc, I have urine infection. How can we manage? So then I had to manage from here. And I got my gynec also on board because she had gone to gynec. And then we advised her what to do from here. Now, she was carrying an antibiotic, but she was having, say, Cital with her. But I said, you have soda there because if you make the urine alkaline, then she's saying, I'm having a lot of burning. So I said, then you take hydrocortisone cream. Locally, you can apply, it will help you. And hydrocortisone cream is available in the CVS pharmacy. So you see, when there's a will, we want to help people, there are ways. So the thing is that she had an antibiotic, she got the cream, she had more sodas, she had sparkling water, and that's like soda when Cital got finished. So then, see, if you have a will, and I had told her that you take my kit, she didn't take. So saying, now I'll come back, I'll please take your kit. My kit has everything from ear drops, eye drops to everything. So I think the kit is something which is really going to be a game changer. Our patients can take it. And we give a certificate prescription for the customer so that it is allowed to be taken. It's called as emergency response and comprehensive medication kit. So whatever you need an emergency, it has a crepe bandage, it has Disprin tablets, it has tablets for diarrhea, it has eye drops, ear drops, it has enterogermina, it has electral, so it has medicines for vertigo. You name it, it has a bronchodilator. You name it, it's there. So this also has come, through a period of time. What should be the kit? So we made a comprehensive kit, and people just love it. People just love it.
And you are so selling it online also?
I'm selling it online, yes. So the aim is to sell it online. I'll take your help, how we can do digital marketing for it. And we've got a pharmacy license also for it. And I'll go through you how we market digitally. We are just formed, no, we are a small startup. So we are looking now how to market it. And we'll take your help in that, sir.
Going a little bit more in the past, how did the industrial medicine click you?
I had done preventive medicine. Community medicine. I'm from Sevagram, Mahatma Gandhi Institute of Medical Sciences. There they had one paper on general practice. Like if you have a heart attack at the village level, how will you manage with the basic resources? So my fundas, the foundation, the basics were very strong. And that has helped me today a lot. And that you being alone, how will you manage? You must know everything. And you must have the skill. You have to be a good doctor. You need to have good communication skill. You need to have good networking skill to get the patients in time to reach a hospital. So the thing is, I decided that I will do occupational from beginning. I love the subject. And like I knew when I was reading preventive medicine, community medicine, occupational health used to come. I used to just love it. So that's why I did my thesis on that. I'm from 80 batch. I did my MD in 88, came to Mumbai in 1991 because I'm from Mumbai. And 1992, I started my practice. But before I started practice, I got consultancy jobs at Hindustan Petroleum and few other companies. And then I decided morning, evening, I'll practice, daytime, I'll work for corporates. But after entering the corporates, I came to know that corporate occupational health is a big field. Companies like Reliance, Siemens, Procter Gamble, they take full-time doctors and they pay them very well, even Indian Oil. So the thing is that this is something students don't know about it. So I try to educate them. And then I found the demand. If you're a good doctor, a good clinician is required. The corporates need good doctor. The skills for industrial medicine. I studied further. I did a course called a certification in industrial health from SRMC Chennai, Kurur, that was affiliated to Harvard. And then I went to Harvard to do advanced engineering, advanced factors, and human engineering, basically for ergonomics, because I like the subject ergonomics. And then I did my PhD. The fascinating for the occupational field is there from beginning. So today also I work for corporates. I do very well. The corporates, I get good money from the corporate consultancy and I do my practice. And I love my job. I'm passionate about occupational. I'm passionate about practice. I just want to help more and more people, whether they are in private practice or in the corporate wellness field. I just want to make life easier for people, better. And now also I'm learning about AI. And because of this learning, it keeps me young. It motivates me to do better and better and better. So that's my story, sir.
How initial days of your occupational health, they were easy or tough? What are the challenges there?
So actually, I was lucky that I got my first job. See, sometimes doctors in the companies, they go on leave. So I went, some doctor on leave, I went there, but they liked me. There was an opening, they called me. So exposure is important. So before I could start my practice, I practiced in South Mumbai, Nepean Sea Road, one of the poshest areas. But a posh area cannot do without poor people. So there's a slum area. So my practice is mixed. There are celebrities, there are slum people, and there are corporate people. Initially, if one company gives you consultancy, I'm not a full timer with them. I could have become a full timer, but I didn't want to because practice is my key, clinical skill is my key. So the thing is, one company gives you little money. So then when I got married, I was not making that much money. So then I went to a senior colleague that please help me get some other consultancy. So then I was going for 5 companies. Okay. And when I went for 5 companies, the amount was good. Now, ultimately, one of the companies said, don't go to 5 companies, stay with us, we'll pay you much better. Because the demand for good doctors is there in occupational health, in corporate, they need doctors. Now, today, the field has expanded, and now today we find that jobs are available, to young doctors at a salary of 80,000 to 1 lakh a month they get. And when they are in the corporate field or in the industrial, by the time 10 to 15 years go, they earn anywhere from 5 to 15 lakhs a month, which is a good amount. So the thing is, it's a field which many of our doctors don't know about it. So industrial medicine, occupational health, corporate wellness is the field which is in demand. And the lifestyle diseases are on the rise, where corporate doctors can play a big role in making lifestyle better, in preventing diseases, and also in picking up disease earlier and giving better quality of life. So it was challenging, but then over the years, I found that it is in demand. And once you're good, you can command that I need this much money to be in your company, because they'll ask you, because it's a field in which negotiation is there. So today I tell them that I need this much. That's why then I'm coming to you. So one way is good. And because you're a consultant, so you're not bound by ceilings which a company has for the employee. So because of your expertise, you can get your good money. It's a good field, and students, medical doctors should explore taking up occupational health as a career.
How do a person who is done his MBBS wants to do occupational medicine? Where should he go? Which branch and how to approach?
Yeah. So see, actually, sir, there is the central labor, the government, they have central labor institutes and regional labor institutes. So today, these regional labor institutes, central labor institutes, they train doctors in a course of 3 months. It's a certificate course called as Affiliate Fellow in Industrial Health, AFIH. It's a 3 month course, full time, 9 to 5. It's not expensive because it's a government course. It may be costing maybe 40 to 50,000 a month. That means the whole course may cost around 1.5 lakhs. Yeah, 3 months certificate course, and after that you get AFIH. Now it has become mandatory for doctors working in factories to have at least a basic AFIH to join the company. Affiliate Fellow Industrial Health. So the regional labor institutes, central labor institutes, these are in Mumbai, Calcutta, Bhubaneswar, there's in Delhi also. So these institutes, they conduct courses to the Directorates General, Factory Advisory Services and Labor Institute, called as DG Fastly in short. And they conduct the courses, they conduct the exams, and they get the degree of AFIH. With that AFIH, then jobs keep on coming. Now, companies like Adani, Mahindra and Mahindra Industries making products, and TVS. So they take only AFIH doctors. So they start with a salary of 1 lakh a month and goes much higher, much higher.
Any MBBS can do that?
Any MBBS can do. Yes, basic quality is MBBS, basic qualification MBBS. Then you take up this course AFIH, 3 months, and then you join the company. Whereas I did a certificate course in industrial health and I did a PhD. Now that was a passion, So the thing is, I want to develop myself further. There are many other courses, but this is the basic. It's very easily available. And those who are interested in industrial health, occupational health, or want to make a career, they should definitely do it.
So how is your day like? Lot of emergencies तो नहीं होती?
I'll tell you, there's another lifestyle medicine specialty has come up. And this is a specialty of the US, lifestyle diseases. So people can become a member of the lifestyle medicine organization. And then they have a exam also. And then you can become a lifestyle medicine specialist. This is something new. Now, you are asking question, my day is tough. Actually, mornings, it's like this. In practice, you should be available morning and evening, daytime. But then, if you're working morning, evening, I'm finding it. I used to keep an assistant in the morning. My assistant goes to the clinic in the morning. I go to corporates in the morning. And the corporates, I have now in Mumbai gone to the suburbs because the central areas have become, more residential and the offices have gone to the suburbs. So I have to travel around 80 to 90 kilometers every day to go to the various corporates. Okay. I go to maybe 2 corporates in a day, 2 or 3 corporates. Some corporates I go once a week. Some are daily, depending on the requirement. So morning, I go to corporates, I go around 8:39, and then I come back around 3:30, and then go to my clinic from 4:30 to 8:30. So you see, I'm busy throughout the day. And then after that, I'm trying to see it becomes difficult, taking your time to look after my health, exercise. I join a 24-hour gym. So 3 to 4 days in a week, I try to go to the gym because if I don't do that, I'm not looking after myself. So this is it. And whenever I get spare time, I'm just reading, trying to do research. And now we started this new venture, Innovative Wellness Sculptors, where we want to think about these kits and also the AI-driven devices. We want to give it them to our patients all over. And so we'll be going now into marketing it and expanding it. And currently, we have only 3 people in the team. So we are going to expand and make it around 6-member team at least as we go ahead.
One last question. What is your message to the newcomers in industrial health?
If you have a passion in life, go for it. That's what I will say. My journey in entrepreneurship has just begun. It's like that. I can stop my practice, just go into the wellness company. But the fact is, I would like to grow slowly, one at a time. Because see, I like my clinical practice. So let me do what I like. But I also want to make life easier for people. So that's the other part. I can stop everything, do that, but then I'm not doing justice to my patients because I do justice to my profession and my patients. So I'll go the slow way. So idea is that you have passion, go for it. I don't know where I'm going to reach. I'm also in the experimental stage. I have joined the Docpreneur Academy. I'm lucky to have joined that. So that's giving some insights. And going ahead, I will require funding. So I'm going to approach Pranav sir and Mugaji, how we can get the funding from some angel investors. And I know there's the right path. We've sensed. I also met Vinita Singh from Shark Tank, and that was around 2 weeks back. They were at a function, and I got an opportunity to put up a question regarding these kits. I said that, see, we have given it in a company where they asked 100, now they're asking for 500. What do you think is the potential? They said, if from 100 they're asking 500, please go ahead. So from there, I'm convinced that my product will do well. Because whenever I showed to anybody, said we want it, my patients are loving it. So the thing is, I am confident that the product will do well. But the only thing that I have to do is see that I pitch it properly, market it properly. And the thing is, I'm going to give it to everyone, all doctors. So it's decided that I'm giving it to all my doctor friends. They can also give it to their patients. It's not just मैं रखने वाला हूँ, मेरे को देना है because I want them to make life easier for their patients. And believe me, there's money for them. There's money for everyone in this, what we are doing. So I'm going to share it with my doctors. They should make life easier for their patients. They'll also make good money. We will also make good money. So that is what my aim is.
सबका भला करो और आपका ही भला होगा.
Yes, that's
If you add prosperity in somebody's life, then you will be prosperous. Great.
इसमें सबका फायदा होगा सर. ये करना है और आपके थ्रू करेंगे if you want. I don't mind. We'll sit down once and see how we go.
If you want to understand how we have helped Dr. Kishore and others, you can click on the link below. There is a website, there is a webinar link, and you can join our webinar and join the community.
Yes, sir. Thank you. Thank you very much, sir. Thank you. Thank you for giving me opportunity to come on to the Hall of Fame. Thank you.
Thank you, sir.